You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. Welcome back to All the Bees. You're listening to Unfiltered Plastic Surgery podcast and all the hot celebrity gossip you don't need to know. Here with me is Bree. Hey,
Good
Bree.
morning.
Today's episode, we're going to talk about how to prep for surgery, which is super important. But, first we got to go through what's up in the Daily Mail.
Nothing says good morning like man dying after penis enlargement.
Yeah. So this happened in Russia, or whatever we're calling that now. I think it's still Russia.
Is it worth enlarging your penis to never be able to use it again?
I mean, he's not using anything because I think he died, unfortunately. But yeah, I know. I mean, women do a lot of high risk things all the time. It's just interesting. I've presented on the risks of fillers, injecting fillers. So when you inject filler in the face, which is more common, it is potentially you can get into a blood vessel, obstruct the blood vessel, and you can end up with either tissue necrosis, so tissue death, or potentially blindness. So generally, that's what we're talking about. But now you can inject filler everywhere, including the penis. And so you could end up with the same problem. You could get necrosis in the penis, which is probably more common, or in this unfortunate case, an embolism and death from having your penis injected.
What kind of filler would you put in the penis? It'd have to be really soft, right?
Yeah, it looks like they're injecting. So the two things you can inject are hyaluronic acid-based fillers, so your Juvederm-based, Restylane-based fillers, like the common fillers we use for our face, lips, etc., and fat. So both can embolize. I think fat might be more common, but I can't speak to that because I don't do this procedure. But, always potential for adding that to our repertoire.
No, there is not.
Yeah, no, we've talked about this before. It is trending. Male genital enhancement is trending. But in an all-female office, we feel pretty strongly that we're not going to dip our toe in that water.
Right. I understand it. I guess it's just like women wanting to enhance their breasts. Their penis is the same thing,
I know. And in this article, there's a bunch of stuff about penis size change and whether penises are getting
how much actual length,
smaller.
Let's see.
And I was like, what? Who's doing this study? And why?
So you're enhancing it 3/4 of an inch, or what is that?
That's just looking at average penis size over time, which has nothing to do with injecting filler into it. Also, in filler, generally, they're using it to enhance the width and not the length because it's hard to increase the length anyway. But yeah, and then I think that was what was interesting is that the use of fillers in the UK and in, I think, Russia is unregulated. So it does vary from state to state in the United States, but you usually need some sort of licensing to inject filler, but any beautician can inject filler into any part of the body with impunity at the moment in the UK.
Crazy.
So that's awesome. Your hairstylist can inject filler, which, as we know, unlike just having your hair fall out or have it break or something because they overcolored it, comes with real risks. And I'm guessing they don't carry Hylenex or have any of the rescue products that you need in case you do get into a blood vessel. So I don't know. Everything comes with consequences, which is why it's important to prep for surgery. And the first thing, if you're going to prep for surgery or for procedures, is to know that your person doing it is credentialed. So
it does say micropenises are usually developed in the womb. So you can just
blame your
lead
mom
with that. Yeah, exactly. It's all genetics. So have a good personality. It'll make up for it.
And a really nice car.
Exactly. A really large truck.
All right, moving on, because we'll get to Blake Lively in a second, but I just have to say we've been obsessed with this in our office, and it's the Meghan Markle, the new show, Netflix show. I mean, Bree, you've actually watched it
the trying to be relatable show. I don't want to absolutely trash this series, so I'm not going to say a lot, but what on earth this was the most unrelatable show possible. I mean, from the get-go, this was just terrible. First off, she's not in her own house. They rented a house down the street where she can pretend to cook and do things in. And it's like, I'm not cooking in an all-white outfit. And then she's pouring. I could go on and on about this. I have so much to say, Megan.
Grossly unreliable. I feel like this girl is hosed because she can't do anything right at this point. Like, she's going to get lambasted no matter what. But she is also, she's sticking herself out there to make money. So I don't know if she's just not surrounding herself with people who are like, girl.
But she's almost giving me like Blake Lively vibes, because the way she went on Mindy about her being a Sussex, like, she didn't say it in like a kind way. She's like, I just can't believe that you would call me Meghan Markle when you know I'm a Sussex. Like, it's so stuffy. It's so stuck up. Like, she doesn't talk like she's not a relatable person. She talks like she is higher than everyone. And then she could have done it tastefully, and I think she did it. No working busy mom is going out to their beehive to get their bees to make honey and then their eggs. And
I mean, I do believe she encourages you to find a bee hive or whatever they call it, a bee farm, so that you can get soy wax so that then you can make your own candles.
I will be buying my candles for $10 at Target. Thank you. That's my TED Talk.
Yeah. And I think there are a lot of this review article about the show is like, talks about how she would eat farm fresh, and that's what, and then in her show, she talks about how they ate TV dinners growing up. So like, which is it? Like, what are we doing here? Like, I don't think she has a clear identity, or she has a clear identity, but she's not putting that forward. So she just comes across as super inauthentic. It's very easy to lambast, and it's so out of touch because it's like, so like, welcome to my home. Actually not my home. Look at me pour, peanut butter pretzels from Trader Joe's into another plastic bag for my friend who loves peanut butter pretzels, but I'm also going to label them in case he has a peanut butter allergy. Like, what are you talking about now? I'm so confused. And what am I learning from that is that I can use plastic and more plastic to like make things look, it's wild. But just like the Mormon Wives, Secret Lives of Mormon Wives, which their second season's coming out in May.
I can't wait to watch.
This guy, Kai Cameron, on Instagram does the best like little skits of them. So he has
so
one here,
good.
Yeah, that he does where he's like, welcome to my new show. Not my house. So welcome to my set.
Yes.
And then
I'm going to wear all white because we obviously cook in all white. And then I am going hot tamales.
And then he takes the tamales out of the box and he puts them in a plastic bag. Or actually, he just rolls them up in saran wrap.
His guests to feel every little detail has been thought about while going into this house. And then she puts corn in a bag and pops it.
But he puts tamales from the garden. I love it.
Just put the tamales. You don't need to make bath salts. If I had the energy and maybe like I was a stay-at-home mom and the money, and I was like making bath salts and candles for people, and then wanted to like write that I grew the bath salts and candles.
Right. You're like a mommy blogger. I get it. It's very trad wife. It's very... Who's that ballet dancer that's like on a farm and makes everything? I mean, they've spoofed her too. Like, I can make my own toothpaste. Why?
Yeah.
Like, you really have nothing else to do. I feel like your kids probably have homework or something that they need help with.
Right.
Just in my experience as a mom, there's better things to do with your time.
She did not. She could have done so much better.
Right. I
for
don't
what
know.
the show is. Or just be
Right.
relatable.
Show us some life hacks, man. This is
My
not.
favorite part was like at the very end when Harry is finally featured in the very last episode and he just looks absolutely miserable. Like trying to remember to smile when the camera comes across.
Well, good news. It got a second season already. So, and I think
Already been filmed.
Netflix loves a controversy. So, and I feel a lot of us hate watched it. So
I did. I 100% hate watched the whole season and I made Eric watch it with me. And it was perfect. It was everything I needed.
All right, let's go on to our next. I love Kai Cameron. Just gonna plug him.
He's
there.
so good.
He should come on the show.
Yeah.
And then back to Blake Livelier. So she has another movie coming out, Another Simple Favor.
When did she film this?
We were trying to remember what A Simple Favor was about, whether we had seen it. I don't think I ever saw it. You and Rachel said you had seen it, but couldn't remember what the plot was.
Yeah.
But somebody decided to make a second one. I mean, I kind of love Anna Kendrick.
Yeah. We're just here for all the Instagram memes and the drama. So
it looks like maybe they didn't get along on the show, or they did, or tolerated. The narrative coming through is that Anna Kendrick and the producer Paul Feig, or director Paul Feig, tolerated Blake Lively and her whole routine. And nobody wants to say anything.
But then every video you see, she is just like dodging every Blake Lively question, like for, good reason. But it just looks so uncomfortable. And then Blake's up there speaking on the stage and Anna just looks like she's looking like, fuck my life.
Right. Like, you can't pay me enough to be here.
Yeah.
Yeah. And then I guess she just tried to post a bunch of pictures of like behind the scenes. Blake Lively did. But in all the pictures, it's just usually her with her squad, like her publisher, her hairstylist, her makeup person. Also, Anna Kendrick is like tiny. Like,
oh, really? Wait,
yeah, I feel like they're
she is tiny.
She's like a little person. I could carry her around in my pocket. That's crazy.
I love that.
Boobs, though, that Blake's wearing.
And but look how big Anna's shoes are too. They're like 4-inch platform.
I know, which
3 inches
has to be like 4'11" or something.
I love that.
More. I'm sure that will continue to feed into our podcast for the entire year.
I'm so surprised, Blake. Like, she has to be so uncomfortable going out and doing all this stuff, right? Like, she just got dragged and still getting dragged through the media. And then she has to go present her new movie.
I guess so. I don't think
Blake,
she cares.
stay home.
I feel like she's
you have
insulated.
enough money.
She's insulated by all the people around her that tell her she's amazing and she's a genius.
Her dragons.
She's good. I don't feel bad.
I don't feel bad for Ryan, but also he like condones it. So
yeah, they're a team. All right. So this is celebrity and plastic surgery related. So this comes around every couple of years with a new celebrity. So there's been a question about, we were just actually randomly talking about Justin Bieber again yesterday in the OR because a song
I thought he was having a mental breakdown. Not quite sure that it's not accurate, but I've just seen so much recently saying he's like doing all this weird stuff, making these weird videos.
But I guess maybe he was just trying to hide the fact that he had a hair transplant. I don't know. So
I think he's going to have a mental breakdown. He's going to pull a Britney soon.
Oh, poor Brit. Anyway, he was seen, I guess, running around without a hat or a beanie. And so in an effort to say that he has not had a hair transplant. But then people, if you scroll down on this article, they do this like super weird close up of his hairline. Okay, so there we see him pixelated. Okay. And I guess the argument is that the hairline, see how his hairline was receding there. And then if you go back up, it's
back.
Not. Yeah. So they're saying he got that filled in with
I believe it.
Which, okay. I mean,
I feel like that picture on the right, if you go up a little bit, is the first actual picture where like he kind of looks kind of good. Like he almost looks like a little Calvin Klein model.
The one where he has hair?
Where he's all, with hair.
And a beard?
in a beard and wet and
it doesn't even look like him.
no,
Yeah, he looks
not
hot
at all.
there.
He does. That's the winner, Justin.
But that's with his fake hairline, which I feel like looks weird in that photo, but whatever. But then it's
not
photoshopped.
fake. It's the same thing as getting a BBL. It's not fake. You're just transferring fat to your butt. It's still your fat.
Your hair. Still your hair. Okay.
Still your hair, still your fat. You're still all natural.
Bria's spoken. No, I'm all for hair transplant. I think it's a great option for men. Also, there's no risk of I won't say there's no risk of dying, but there's a lot less than getting your penis injected of having some.
It's true.
As long as you do it, I cannot restate this enough, at a reputable place.
Don't
People
use your
are
pubic
going
hair
to Turkey and getting these crazy hair transplants for cheap, and then having scalp necrosis and massive infections and horrible hairlines. 90% of doing this is doing it so it looks natural, which is all about the placement of the hair. And then, so don't go to some garage in Turkey and get it done, please. Make sure it's somebody credentialed.
Take the Turkish hairlines to someone's basement.
I know. But yeah, I mean, it is your own hair. So you're right. It looks good. It just takes a long time. You have to be patient. It takes a long time for the hair to grow out.
Oh.
Some of it you're going to lose. It usually takes multiple rounds, depending on, how much hair loss you have. It can be supplemented with some medication to improve the hair growth. If it's done properly, like Justin Bieber looks like he's had it done properly, I think it's a win.
I would hope he has it done properly.
I mean, it looks like he has. I can't imagine he is going to cheap out on that. He wants somebody with discretion and somebody who knows what they're doing. So props to whoever did it.
He looks good.
Yeah, I like it.
Even if you're having a mental breakdown, Justin, you look good.
I know. That baby face. He almost kind of looks like Scott Disick. I'm just kidding.
That's tragic. Did you see the Timothy Chalamet, what was it, SNL, and he did the baby face song?
Oh, no, I didn't see that.
I'll have to show that to you.
Okay.
It's so good.
Catch up. I did see Scott Disick on that other Mindy Kaling show, Running Point, where he shows up in the
Oh, yeah. That was such a good show. Okay, Kate Hudson.
I know. It was cute. Okay.
Good thing to come back to. She hasn't been on anything in a while, I feel like.
Yeah. She was cute in it, and the Scott Disick cameo was weird, but
Netflix, bring out Running Point another season, not Meghan Markle with love and inauthenticity.
Your inauthentic self.
Oh, Jesus.
Oh, my God. Okay. All right, let's get to the meat of it. So today's topic, how to prep for surgery. First up, there's a Forbes article, which I think is interesting it's from last year. Okay. So this is not new. I love this photo of everybody leaning over the patient because this is exactly what it's like when you go to sleep. JK.
You just see my face.
I mean, you're going to see the mask, but there's not 4 people peering over you, just the anesthesiologist. Jesus.
I know.
Anyway.
It's a little extra.
It is extra. I was just speaking to a patient yesterday that was starting tirzepatide with our office who has surgery scheduled. And I was like, well, you need to stop 2 weeks before surgery so that you don't aspirate. And she was like, wait, what? So it's not well known amongst patients, which is important because although you might be prescribed Ozempic, Wegovy, Mounjaro, Zepbound, you also might be getting it as a compounded formulation outside of the insurance. And I think it's become so, what's the word? Ubiquitous
and a commonplace. So common.
It's become so commonplace that patients don't even think to mention it when you ask them about what medications they're taking.
I think the best way to prep for surgery is to have transparency. And I don't understand sometimes why patients don't feel it's necessary you're going to a place to be put to sleep and have a surgery. And people don't find the importance in letting you know medical history, medications they're taking. Oh, I'm just casually taking blood thinners or I'm on GLP-1s. And I don't think if you want to prep for surgery, transparency is the most important thing right now that I feel like you can do? Because you've had a couple patients that have, like, I think one of them, while she was maybe going to sleep or the morning of her procedure, she was like going out of it and she's like, oh, I'm on this, and this. And it's like, yeah, I mean, you'll get your surgery canceled for that. Like, it's very important. Our anesthesiologist is very by the book. He's not going to mess around. If you have an increased risk of aspiration because you're taking a drug that he doesn't know you're taking, he's not going to do your surgery. This is an elective procedure, and there's no point of jeopardizing anyone's safety for not telling your provider the medications you're taking.
Amen. Well
Amen,
said.
sister.
Yes.
Call it a wrap.
No, I think there are two kinds of patients. There's the patients who know that they're not supposed to be smoking. They're supposed to let us know all the hinky supplements they're on. They're supposed to let us know that they're on GLP-1 drugs. Fen is another one that we need to know about. But they withhold that information because they know we're going to tell them no. So that's one set of patients. And then I think there's the people who like genuinely just don't think of it. Like, oh, the supplement I take every morning is not a medication. And so I just don't even think that that's something I need to tell my doctor. So it ends up being on us to kind of be like, are there any things you want to tell us? It's like when I see a new patient and they say no surgeries, and then I'm examining them and I'm like, okay, well, what about these incisions on your abdomen? Oh, right. I had a laparoscopic blah, 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 or I've had lipo before. They just forget. They're not trying to, like, I'm going to find out. So I think sometimes they're not trying to be misleading. They're just not thinking about it. So I think education is important so that you understand the reason we need to know this might be something that you are unaware of, which is that GLP-1s used to manage diabetes, it's not like metformin. You will not empty your stomach out. And currently, whatever the American Society of Anesthesiologists recommends coming off of it for 2 weeks before elective surgery. Now, if you get appendicitis and have to go to the hospital and they need to put you asleep to take your appendix out and you've been on Ozempic, are they going to still do it? Yeah, they're not going to make you wait 2 weeks. Is there an increased risk of aspirating, which means basically vomiting and then ending up with that in your lungs at the time of anesthesia? Yes. Are there things they can do to help reduce that? Yes. But that's called a rapid sequence intubation, and it's not something routinely done unless necessary, usually done for emergency procedures. And so you don't want to aspirate and get aspiration pneumonia because you're having your implants exchanged and you forgot to tell us. So
not worth it.
It isn't worth it. Now, what's interesting, I think this restriction will possibly get modified over time, but this is like the safest, most conservative option, because if you are taking it to manage your obesity or your type 2 your diabetes per se, then the recommendation is to not come off of it for as long, but it's still a little squishy because a lot of people are on something else in addition to GLP-1s for their diabetes. So, if you're on insulin or something like that, then we're going to also deal with that as part of your preoperative planning. Like, when do you take the last dose? We're going to check your sugars during the procedure. So all of that's relevant for us. And I know people think, oh, what do you need to know about that? We need to know.
If your liver is not working properly,
need to know.
Please
tell us. Yeah. And then the category of patients who don't tell us because they're afraid of getting canceled or something. I mean, again, it's just not worth it. So
safe surgery is the only kind of surgery we like to do.
Absolutely. And then fen's another one. That's actually, I'm always surprised when people are on that medication because I thought we weren't using that anymore for weight loss, but that messes with your blood pressure and can make it kind of crazy during your anesthetic. And so again, we have patients come off of that prior to surgery. So it's helpful if we know that you're on it.
Yeah.
It's an actual medication.
Yeah. I think one patient actually said as she was going under,
also
while mask coming down, That's what she said. Those were like her last words.
It's usually that, or I also smoked a cigarette right before. Like it's the two. It's like they get a little truth serum as they're going to sleep, and they're like,
right.
I'm smoking. And then you're like,
it's just
what?
so important. I mean, nicotine delays wound healing in pretty much every surgery. It's not like I'm going to be the exception. Just if you're going to have surgery in an elective, non-emergency situation, just do it. Do it the right way.
Right. Quit.
Let's minimize all risks here.
Right. So that leads us to our next category, which is how to prep for surgery. Don't smoke. So usually when I ask people if they're smoking and they say no, I say, well, don't start.
Right. I know. And if you are smoking, you're most likely going to get nicotine tested before the morning of your procedure.
Right. And there have been studies on this, and it's shown usually if someone tells me they smoke at like a consult, and then we say, okay, well, you need to quit. We're going to test you before surgery. Those people usually quit and are in the clear. It's the ones that say, I used to smoke, I don't smoke anymore, are usually the liars in all of this. They are actually still smoking. They've learned to say that they're not smoking anymore. So we still test them as well. If you give us any hint that you might be smoking, that's
right.
We're going to test, because it's not worth it to have any kind of complications. So smoking and surgery are a bad combination. Back to anesthesia. It hurts your lungs to smoke. So even for those who smoke marijuana, any vaping, anything that's going in your lungs, it's compromising your lungs. And then when anesthesia is breathing for you during the surgery, you also, you wake up, sometimes you have a cough, your lungs aren't fully expanded. We want you to take deep breaths after surgery. All of that is, you're not at your best self when you've been smoking up to the day of your anesthetic. So those lungs are not healthy, and it can take a couple weeks, 2 to 4 weeks, to kind of clear the damage that your cigarette smoking is doing. And that's why we recommend a month before and a month after. First of all, anesthesia is not going to be happy if you're smoking. So for those of you on smoking marijuana, we say switch to edibles, because it's not the marijuana, it's the inhalational damage. Number 2, the heart has to work harder. Enough said. And then the part that really, really is where plastic surgeons get excited about is nicotine inhibits wound healing. So your tissues aren't getting as oxygenated, and the nicotine actually inhibits wound healing. So if I'm making an incision, I need it to heal. And if you're doing nicotine anything, whether it's inhalational or a nicotine patch or nicotine gum, all of those things are going to make the little blood vessels in your body kind of shrink down, and then you can have wound healing problems. That means the incision can fall apart. You can get tissue necrosis, which is the tissue essentially dying. It's just gnarly. So don't do it.
Don't smoke.
Right. One of the worst procedures you can do is labiaplasty, which we do a lot of if you're smoking, because
Can you just imagine that part of your body not healing well?
yeah, falling apart. It's no bueno. And then the other area we get super excited about is anytime I'm messing around with the nipple. So any kind of breast lift, breast augmentation, breast reduction, implant exchange, anytime we're breast implant removal, we're kind of doing something to the breast tissue and rearranging it, we're interrupting the blood supply to the nipple and the areolar complex. And so what I don't need is an additional interruption to the blood supply via smoking or nicotine. Quit.
Mic
Just
drop.
for that time. Yeah. Also, if we're doing fat transfer, again, because of the blood supply issues, you're at an increased risk for fat necrosis and having
We
wound healing
want the
problems
fat to stay.
Yes. If you're going to bother to take the fat out and put it somewhere else.
It's valuable fat. That's fat you're not going to have back in your body, unless you're transferring it, of course. But
less and less people smoke, at least in Southern California, but a lot of people do vape, which is the same freaking thing. So just make sure you're letting us know. And then you absolutely need to quit 2 to 4 weeks before, and you need to stay quitting for 2 weeks after. And then once you're healed, if you want to go back to poisoning your body, go for it. But I'm not trying to be judgy. I just literally need you to have the safest possible surgery and have the best results possible. And that's why we harp on smoking so much.
Right. And speaking of fat transfer, nutrition is so important after surgery. And a lot of patients feel like once they have surgery, it's like their time to like starve themselves and lose weight of some sorts. If you are having surgery, you need to maintain your nutrition. If you're getting a fat transfer, I always say you got to feed your fat. Okay. Like we need to optimize survival. Do not start starving yourself after surgery. I feel like it's the most common thing that I hear.
Yeah,
Just not eating. I'm not eating.
Yeah. They're not hungry from maybe the medications. You're tired. Wounds need nutrition to heal, and that's protein, that's hydration, basic vitamins that you can get from eating whole foods. Eating, so the two things can be not eating or eating garbage. Like, please don't eat processed foods and
cheeseburger and milkshake.
Yeah, peanut M&Ms.
Yeah, please don't.
I once had a patient who had a tummy tuck or some sort of surgery. It might have been a tummy tuck, but this was back when I was at the Navy hospital. We went to go see her the first morning after surgery because everyone stayed overnight there. And she had Krispy Kreme delivered. And I thought, really? What are we doing here?
Maybe if you're having a baby.
Yes.
Okay. There is no other acceptable like food delivery, Krispy Kreme, cheeseburger, unless you're having a baby. Okay.
But yeah, right after having liposuction or some body contouring surgery, Krispy Kreme's not going to help you heal.
No. And I also, a common thing is people are like, well, I've had lipo. I'm not going to ever gain weight back in that place. That's just not how it works, first off.
No.
And then if you're spending all of this money to have surgery and then you're getting a fat transfer to your breast or to your butt or to wherever you're getting it and you stop eating, don't waste it. Your post-op care is just as important as having surgery. We were talking to another doctor the other day who did a facelift and his patient went back on her tirzepatide right after the procedure. And he's like, the wound completely stopped healing. He's like, the second she stopped eating, we put her back on nutrition shakes and so forth. But nutrition is so important.
Yeah, you need extra calories to heal. It's most demonstrable in like burns. So when people are burned, they need so many calories. So if you've ever done a burn rotation or worked on a burn unit, they have all this food stocked there because they really need the patients to eat. So they just need calories. So this isn't as intense as a burn, but any kind of incision or surgery requires healing and you need to keep your energy up. So usually I think it's a 0.5 gram of protein per kilogram of body weight. So you're aiming for at least 50 grams of protein a day, and you can go up from there. More is sometimes better up to a point. So if you're having more than 100 grams of protein for the average size woman, then you're probably not doing yourselves any favors. You're just going to excrete that extra protein. It's going to make your stomach hurt. But somewhere between 50 and 100 grams of protein is a good starting point, and making sure that you're just paying attention to protein intake is helpful. And then balanced diet or take a multivitamin.
Yeah, definitely.
If you have a hard time like trying to, choke down grilled chicken and broccoli or something after surgery, then yeah, a protein shake or a nutrition shake is a great option, honestly. Or something lighter, but making sure you're taking a multivitamin with it is also a great option so that you make sure you're getting all the nutrients that you need for healing.
Feed the fat.
Feed the fat. Yes.
Keep it
Feed
all
the
of
incision.
Yeah. Feed the incision.
Incision wants to heal. Okay, so no smoking. Tell us about your medications, including GLP-1s. And then what they don't tell you about a BBL, a TikToker's Brazilian butt lift warning goes viral. I mean,
let's hear it.
A cautionary tale where
she contracted a hand, foot, and mouth from shopping at Goodwill.
No one told her how to sit, how to sleeping, showering, cleaning her support garments, and the emotion. So basically, she had a normal process, but didn't have any info.
Which leads you to believe what kind of office did she go to. And I could be totally wrong to get this done because when we do pre-ops, I mean, we're telling you pretty much supplements. We're going through how you can sit, like we're giving you advice, we're giving you post-op instructions, pre-op instructions. I mean, we even tell you like how to shower the night before. I feel like we're very big on post-op care here. So if you're going to an office who gives you no, I mean, even if they do give you no post-op care, you can pretty much go on
Google
Google and do anything. When I had my first one, I watched so many YouTube videos. Like I felt more prepared just watching YouTube, you know? So I think that's also, you have to advocate for yourself too and do your research. You know, you don't just go in and have a procedure and then just think, oh, I'm going to have surgery. I don't need to do anything else. Like, yes, you do. You need to not sit on your butt for a certain amount of time. You need to wear your garments, specific garments. Like there's a lot. Surgery is a big thing, even though like I feel like people take it like so lightly. Oh, it's easy.
Right. And we do try to prep people as much as possible. And again, there's patients that take all the information that we give them and like take notes and ask questions and are super, attentive. And we do understand that when you're talking to a patient or talking to anybody, they get about 10% of what you said is
Right.
retained. Like, let's take our average labiaplasty patient. When they come in, Bree, well, first of all, they talk to Ava. Ava asks them the questions that we think are important. Are you smoking? Do you have any history of herpes or yeast infections? Because that impacts the medication treatment you're going to get around the time of surgery. And what's your time frame for surgery? These are the restrictions after surgery. So don't come in and be planning to move to Dubai in 2 weeks and think we're going to do your surgery really quick, for example. And then they meet with Bree and go through your spiel with them because it's very similar.
Yeah, I started and I pretty much tell them from the get-go, I'm like, what I'm going to say, there's going to be a lot of repetitiveness. I ask a lot of the same questions. I go through pre-op, post-op. I go through our medications. I go through their medical history, their allergies, reconfirm medications they're taking. We go through the procedure. We go through the layers of suturing. I go through yeast infections. I go through why it's important to let us know this. And then at the end, I bring Dr. Gallus in and she goes through the procedure again. And then after that, I let them know that I'm going to send them an email a week prior to the procedure, which also has the pre and post-op instructions in it, medications, everything we talked about. And then there's that, like you said, that half the population will like have it ingrained in their brain by then. And then half will be like, wait, what? I have no idea.
What? Nobody told me anything. Oh, also
Yeah.
Ava, when she meets with the patient after we've gone through our spiels, she meets with them and she gives them a packet, a printed packet with pre and post-op instructions. Because again, for these particular patients, it's under local. So we're not even getting into the anesthesia side of things, but it's under local and they don't come back again until it's the day of their procedure. So we are making sure that this is like, you are fully informed. So they have it in their hot little hands. Then Bree emails it to them again. And then on the day of the procedure, we review it yet again. But at least you have been given the opportunity to prep and know, okay, I'm going to need to lay flat. I'm going to need to put my butt on a pillow. I need to have some towels. I need to not to have have pads available or period underwear or whatever it is you're going to wear for the few days afterwards. Know where your loose sweatpants are. All of those things are, you don't want to be doing that after we've just done the procedure and you're waiting for the local to wear off. Prep and the like post-op care are super important and we can't underscore that enough.
Right.
And yet we still have people who are like, gonna go to Spain.
And here's another thing. People are like, oh, I have time off from work for this 2 weeks because I'm healing from surgery. I'm going to book a trip. That mindset to me, I can't understand. You need to rest, let your body heal. Don't go to other countries, go skiing, go cliff diving, do whatever that was not the time.
Yeah, no, you need to like take up scrapbooking or organize your photos or something lame. I mean, I used to go through you're going to be, kind of stuck at home for 2 weeks. So if you don't work from home, it can get a little You can go a little stir crazy, but that is not the time to start moving your furniture around or overhauling your closet because we want you to take it easy. So
Right.
find something that is relaxing, whether it's binging, hate watching Meghan Markle's new show, or reading a book,
That'll make you even more stir crazy.
or finding some project, you wanted to, reorganize the photos on your computer or on your phone or like stupid stuff like that that you never have time for. Those are the things you can do. But
Right.
please don't jet off somewhere because you're going to be in the airport, you're going to be hauling luggage. Like, so we definitely I think prepping for surgery includes deciding what you're going to do after surgery while you're healing. And that is putting your gym membership on pause because you're not going to be able to go for at least 2 weeks. So just put it on pause for a month and then you don't feel like, oh, I just paid for something I'm not going to use. Like those are all
Finding appropriate childcare, making sure somebody can help if you have small children. When we ask all those questions in their pre-op, do you have somebody to help you? Do you have somebody to help if they want to be lifted up and you're not supposed to be lifting? Even planning your meals, planning childcare, planning what you're going to do after. Everything comes into play after surgery.
I recently did a minimally invasive neck lift on a patient and she looks so good. And she's like the perfect patient.
She was
And
so on
she's
top
like,
of her post-op care.
when can I stop wearing my garment? And I was like, I feel like she was like 6 weeks out. I was like, oh my gosh, bless you. You've been wearing it. That's
I wore
why.
my first garment for 6 months, actually
I
both
know.
times. And then I had a lift done through another doctor and I ended up getting a hematoma. And the suggestion was to not wear a bra post mastopexy, which was not what I should have been told. No hard feelings or whatever I'm supposed to say here. But anyways, because I didn't wear a bra and a lot of people hate wearing it. And they're like, when can I just go back to, I just got to lift free nips. That's fine. But my incisions particularly stretched out and I had to get it all redone because I was told not to wear a bra. I feel like there are certain things, your garments are important for swelling. It's important for compression. I mean, they help. Just wear them. Just do it.
They really do. I wish I had that series of photos that Megan took where she had liposuction and a fat transfer to her breast. And then she had a photo of herself pre, then post, early on. Then when she kind of got to her final result, like at 3 months, and then wearing compression at that 3 months and what she looked like, and then not wearing compression at that 3 months and what she looked like. And it made a huge difference because you're still healing for 3 to 6 months afterwards.
Right.
So it's very important, which is why we make you come back post-op day 1 and check to make sure your garment fits properly. Like we really
Right.
want it to work for you.
If you have lipo, they're going to get smaller. Come back, get a smaller garment, order a smaller garment, get your lymphatic massages, get the fluid moving. There's so many things post-operatively to do that are so important.
We really do feel strongly like taking some sort of multivitamin or supplement is important. So we do give you Heal Fast, which is a supplement that has all the things you need for healing. We give you that at your pre-op visit and you can keep taking it afterwards. And we also give you arnica because I feel like it does help reduce bruising and swelling. You do need to take your pain medication. I always say no one gets points for not taking it. You don't want to be in pain. You don't want to be uncomfortable. I don't want you to be pain-free because I don't want you running around doing crazy stuff. But I want you to be comfortable, not have your blood pressure skyrocket because you're in so much pain. You need to take your antibiotics if that's what we're prescribing you because it helps prevent infection. If you're on a blood thinner or GLP-1, we're going to tell you to not take it for 2 weeks and then not take it for 2 weeks, potentially after surgery. So don't ignore our request.
Think about when I had I always relate it to experiences. My second lift after I got it redone, I felt so good. I was like, oh, I'm good to go. I was moving after day 2, popped a stitch. After the pocket was closed up that you can't be refixed unless you have surgery again. Like you may feel good, but take it easy. Rest.
It's so hard. I mean, I get it. It's so hard. We're all very fitness oriented. I think when I had my breast dog at 4 weeks, I was like, can I go back? And the argument was like, really, you just can't suck it up for 2 more weeks just to make sure.
Yeah.
2 weeks is really a small drop of time in the grand scheme of things. So just, really be sure that it's time to go back.
A lot of patients ask if they can take their garments off for like events post-surgery. I feel like that's a very common question. And it's like, you can take it off, but you might be a little bit more swollen after. Put it on right when you get home.
Mm-hmm. Yeah.
And keep it off indefinitely.
Absolutely. Why is this important? It gives you the best result and then also decreases the need for having a revision or having to do something again. So it's worth it. Definitely worth it. And we're here to help you with that. So if you're going somewhere and they're not giving you a lot of information about pre and post-op care, then I would think about how much support you're going to get after surgery from them and maybe ask those questions, because most good board certified plastic surgeons are gonna let you know what you need to do.
And maybe you can touch on why it's important to finish your antibiotics, because I know nowadays people do not like to take antibiotics.
I'm not a huge proponent of using antibiotics when they're not necessary. So in labiaplasty, I don't use antibiotic, but for most other procedures, I do. And you need to take it for the full course, because if you're taking, 2 or 3 days of antibiotics and then just stopping and not taking the full course, and it's been shown that you're just putting yourself at risk for resistant bugs, resistant bacteria. So that's why you're supposed to take it for the whole course. So all you've done is like knock out the bacteria that's, the weakest link. And then whatever bacteria was able to hang on for the 3 days is going to come back stronger than ever because you didn't give a full 7 days of antibiotics to knock it out. So that's kind of how that works. That's why we have those, what we used to call football times of antibiotics. It's like a football score, 7 days, 21 days. Now with a 2-point turnover, I feel like it's really messed things up. But back in the day when I was a baby resident, we were like, it's, 7 days, 21 days, 14 days. Like, why are these all football scores?
But I'm just impressed you know that, because
that I know a football score or a 2-point conversion.
Yeah, I'm like, I don't even know what that is.
All right. This is not a sports podcast. This is the
Go sports.
Go sports. All right. Well, if you have questions about post-op care or recovery, we encourage you to check out our website, explore our YouTube channel where we all have videos about that. If you need information about scheduling, financing, reviews, photos, definitely reach out and give us a call.
Yeah. Give us a ring-a-ling.
I'm gonna pretend
unless you have a ding-a-ling.
Yeah. Yeah, unless you want penis enhancement surgery, then we're not here to help. Sorry.
Then you're done.
Anything else, though, we're here for you. All right. So that's a wrap. Thanks for joining.
All right. Be back soon. Catch you later, bitches.
Bye. If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at restoresdplasticsurgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.